This video will be on diaphragmatic breathing. And again, I have just the sports bra so that it's easier to see my rib and my abdominal movement. But please do this at home however you feel comfortable, perfectly clothed. Do in your sports bra, it doesn't really matter. But for the purposes of this video, that's why I'm sort of dressed like I am. So with diaphragmatic breathing, there are a couple of ways that you can do it. And honestly, kind of mixing in all three is optimal. But when you're first learning how to do this, we try to just stick with one version of this. So I'm going to show you the one version first, and then go to a second version, and then show you a third version. When you are doing this for homework, really just feel like you've mastered one and then progress to adding in that second one, and then ultimately that third one as well. Again, positioning wise, start on your back. That's going to be the easiest because you won't have to think about as many things. Ultimately, then you can do this diaphragmatic breathing in any position, okay? So it's important to remember that your diaphragm and your pelvic floor mirror each other, right? They have a piston relationship. And so when we are doing this diaphragmatic breathing, we are in essence trying to engage the diaphragm down to get the pelvic floor to also drop and go down. Now, depending on what you're coming in for diagnosis wise, it could be your purpose is solely to get that pelvic floor to relax and get it to move a little bit better. But I do have some patients that I do the belly breathing in order to just give that pelvic floor a better starting position. And then we squeeze and contract and do a Kegel off of that. So you and I would have had this conversation already as far as what your purpose is. But this video really is just to kind of give you a nice refresher and to have a reference point if you're at home and you just kind of want to see what it's supposed to look like again. So I'm going to start first on my belly because it's typically how I teach patients in the clinic. And we're going to first go with abdominal movement for the diaphragmatic breathing. This video is going to be a little bit longer, so feel free to fast forward to whatever portion of it is pertinent to you. So on your back, let me get the clip out of the way. So you're going to put one hand on your chest and one hand on your tummy. And the reason for that is really to make sure that your chest isn't doing too much moving. Most of us breathe through our chest, and the diaphragm doesn't really have to work very hard. So you're going to take a breath in and try to make only your belly move and not your hand. Okay, so breathe in, breathe out normal. Now, if we are doing this exercise to work on your strength, I would have cued you to actually perform a Kegel on that exhale. But for the purposes of this video, it's just the breathing portion. Okay, so if you're not sure which version you're supposed to do, then please shoot me a message and I should be able to give you some clarification. Okay, breathe in. See my belly come up, exhale. My chest is not really moving at all. So what's happening is as I'm breathing in, my diaphragm is coming down. So my lungs are filling this way instead of this way. And because that abdominal contents has to go somewhere, that's what actually makes it look like you're raising. You don't have lungs in your belly, so the reason your belly is moving is just because of the abdominal contents. Okay, so when that diaphragm drops, your pelvic floor is also dropping and relaxing. The other beautiful thing that happens with diaphragmatic breathing is we're getting a little bit of a bowel massage at the same time, right? Because those bowels are getting some motion as the diaphragm is coming down and massaging on them. So who doesn't want to poop better? I mean, come on. This is just the exercise that keeps on giving. So I'm going to show you one more time, and then we'll go on to the second version. So breathe in. Okay. Normally, I just tell patients to do this for 5 minutes or so. Excuse me. And I just set a timer. And whenever, if you start to get lightheaded, just breathe normal for a little bit. All right. So the next version is not focusing so much on the abdominal movement as it is the rib movement. Now, I want you to think of your rib cage like an umbrella. Right now, that umbrella is closed. Okay. When your diaphragm engages, ideally, it engages in 360 degrees. And so your rib cage should really then open in all directions. And so that's really important, again, for spinal movement, just making sure that your organs have a lot of nice blood flow and oxygen. So I'm going to put my hands here, and you should see them come out when I do the belly breathing this time. So you're going to take that breath in and exhale. So not a whole lot happened at the belly that time, but that's okay because our focus is something different this time. So breathe in, ribs go out, exhale. Okay. Now again, you can do this laying down, you can do this sitting, it doesn't really matter because you should be able to breathe in no matter what position that you're in. But once you've sort of mastered the just standard laying on your back belly breathing, give this a try and really make sure that your body can engage that diaphragm in all planes and really open that umbrella beautifully. Okay. The third version of this is specifically going to try and target one area of movement. So if you're on your belly, for example, and you're breathing, you really are going to try to breathe into your back. So think about a crocodile or an alligator laying in the water, and you can just see a little bit of that movement up above the water. The other position you can do this in is on your side, where you're really just trying to focus on one side. And you and I would have had this conversation as to which position to do this in. So if this doesn't really make much sense to you, it's because we haven't had that conversation, and you don't need to worry about picking a side, so to speak. But I will show you the one on my belly and then on my side. Okay. So I want you to pay attention to my back. So in this position, when I breathe in, you should see a lot more motion happening at my back. Okay. Or, like I said, we can do it on our side. Put that arm there. Breathe. Exhale. Okay. So I cannot stress this enough. Breathing is one of the most important exercises that you will get during pelvic floor therapy. It really is the key to a lot of things within your pelvic floor, within your abdomen. It's the foundation, and it really is the center of your body. So if you have any questions, please let me know, and I can give you some more specific guidance, but use this video as a resource just for some visual reminders of what it is that we talk about in the clinic.